So the next type of lower back pain we're going to talk about today is facet joint pain. And facet joints are the little joints that open up. You can see those little articulations in here. Those are little joints. They're gliding joints. And what they do is help to steer and bend and just glide and get a person into their normal range of motion. So you have pairs of facet joints on the top and bottom of each vertebra. So there's basically 4 little joints on each vertebra. And then the L5 vertebra articulates with what's called the sacrum, which is this bone here. Facet joints have a lot of nerve supply, and they can cause a lot of discomfort, and oftentimes they're improperly diagnosed. So somebody might be diagnosed with a disc problem when in fact they have a facet joint problem. And it depends on a few things, but in general, if you find that bending back like this aggravates your pain, it's either one of 2 things. It's either facet joints or it's something called spondylolisthesis. And that's kind of a rare thing. We're not going to really cover that in the video. But facet joints are typically aggravated by that. Athletes get facet joint problems too if they're doing a lot of extension. So if they're gymnasts or they're cheerleaders or doing something where it requires that their spine extend a lot. Even tennis players and soccer players, we've seen it now where they're in a lot of extension and they'll get facet joint pain. And it's very painful, and it can ruin an athletic season, especially in certain athletes like gymnasts, because they're doing tons and tons of extension, and it can really aggravate them when they try to do any type of tumbling passes, especially back tumbling passes. The protection for facet joints is really the muscles. So when we look at the spine, this spine doesn't have any of the muscles, but there's multiple muscle attachments that determine the shape of the spine. So the spine should have like a curve like this, and that's determined by your hip flexors, your buttocks, your back muscles, and your abdominal muscles. And they're playing basically a symphony. So they each need to do their part. And when one doesn't do what it's supposed to do, you'll get changes in curve. You may get exaggerated curves. You may get not enough curve. You may get lateral movements side to side. And so all these different things can happen when the spine gets out of balance. So facet joints, we treat them differently. So there's some exercises we do with them that are not the same as what we would do for disc type things. So because the disc exercises are going to aggravate the facet joint patient and vice versa. So you have to be real careful in knowing what the diagnosis is before you do exercises. That's why there's no one size fits all lower back exercises, because they're, like we showed here, there's basically 5 different sources of pain. So if you're getting up in the morning, you have a lot of lower back pain, and you try to stretch and bend back and you get like real hard pain in your lower back, it's probably the facet joints. If you can't bend, or when you bend you get intense back pain or leg pain, it's probably disc. If your leg is just aching all the time, it's probably nerve, and it could also be disc. Okay. So these other types we're going to talk about next. But remember, there's just multiple sources. It's not easy, and it's partly the reason why back pain is such a tricky thing to treat, because there's multiple sources of pain.